Well, hello everyone, and welcome to this sleep therapy clinic presentation on the causes, treatments and effects of snoring and sleep apnea. I hope you'll find the presentation interesting, informative and very, very helpful. Snoring and sleep apnea are part of a group of conditions that are generically referred to as sleep-disordered breathing conditions, or SDB conditions. As that term describes, it refers to people whose breathing is disordered or disturbed while they sleep, generally as a result of the soft tissue of the upper airway collapsing into the airway and either restricting or obstructing it. In the diagram that you see on screen at the moment, you can see a healthy or normal breather where the tongue mass and the pharyngeal walls, the soft palate and so forth are all clear of the airway, and so there's no obstruction or restriction as the air flows in. In the second of the diagrams, the middle diagram, you can see where the tongue mass has started to fall back into the airway, and this is causing a fluttering noise as the air passes by it, otherwise known as snoring. And in the final of the three diagrams, you can see where the tongue mass has fully collapsed into the airway, along with the alveolar and perhaps part of the soft palate and pharyngeal walls, and we have an obstruction of the airway there. That is, the person's ability to breathe is literally prevented because the soft tissue has collapsed across the start of the hard airway, or the trachea, the windpipe. Underneath the right-hand diagram, you can also see the levels of severity for obstructive sleep apnea. 5 to 15 events per hour is considered mild, 15 to 30 is considered moderate, and 30 or more is considered to be severe obstructive sleep apnea. Now, the interesting thing is that each apneic event, that is, each event where a person has or suffers from apnea, where they stop breathing in their sleep, is at least 10 seconds, although it is completely routine for us to see patients who stop breathing for 20 or 30 or 40 seconds at a time. We've seen patients who've stopped breathing for up to 2 minutes at a time while they're asleep. This is obviously having an adverse impact on the quality of their sleep and on the whole physiology of their bodies. An interesting feature of sleep-disordered breathing conditions is that they're extremely common. In fact, in recent medical literature, they've been referred to as a hidden epidemic. The strange thing is that the hidden epidemic is actually hidden in full sight of us, because we all know someone who snores, or we might even be a snorer ourselves, and snoring is a form of sleep-disordered breathing. As the name suggests, it's a clear, loud signal that the breathing is not natural or normal and unimpaired. In fact, statistics suggest that roughly 30% of all adults, 10% of all children suffer from some form of sleep-disordered breathing. So it's a very, very common condition, although in many cases it's undiagnosed, and as a consequence it's untreated. For people who are already under treatment for other conditions such as hypertension or obesity or ischemic heart disease or acid reflux and so forth, then a vastly increased number of those patients would be suffering from sleep-disordered breathing conditions, because they often are underlying causes of those consequences. In fact, there is now clear medical evidence that there are links between sleep-disordered breathing, particularly sleep apnea, and a whole range of serious side effects, consequences and comorbidities, some of which are listed on the slide that you see in front of you at the moment. Scientific papers have been written on this. If you're interested, you can find them on the research page of our website at www.sleeptherapyclinic.com. But note that if you see these conditions existing in a person, and especially if you also see them snoring, then it is almost certain that they have an underlying and perhaps undiagnosed / untreated apneic condition which deserves immediate attention. In terms of treatment options, there are basically three professional options available. The first, in fact the last option, is surgical intervention. That is always the choice of last resort, but sometimes it's necessary to either remove tension or reduce excess or floppy tissue. More commonly, the solution would be via an airway pressurizing system, typically known as CPAP, constant positive airway pressurization. or an oral appliance or oral appliance therapy. We'll have a look at those in more detail in a moment. As I said, surgical intervention is considered a last resort option for obvious reasons. So you can see by the diagram here that it involves the removal of excess or floppy tissue from the roof of the mouth, so that there is less floppiness, less flutter, less obstruction in the oral cavity, and therefore less likelihood of that soft tissue collapsing into the airway. It's a painful condition, it's an expensive one, and it's not always successful, so it is very much a last resort treatment for people with conditions, sleep disordered breathing conditions, but sometimes it is the only resort available. A far more commonly used form of treatment for sleep apnea is through constant positive airway pressure. This is by far the gold standard form of treatment for even the most extreme conditions of sleep disordered breathing, because it works effectively 100% of the time, provided that the patient wears the mask and the associated pump. Unlike common perception, the CPAP system does not breathe for the patient. All it does is gently introduce pressurized air into the airway through the hose and masks, and that creates an air splint in the soft upper airway to hold the walls of the airway proud, so that the person can breathe in and out without obstruction, without the soft tissue falling in on itself and causing them to suck their soft tissue in harder every time they try to breathe. Now, as you might expect, CPAP does take some getting used to. Most people have a degree of discomfort associated with wearing the headgear and masks and so forth, but one of the things that we're particularly proud of at the sleep therapy clinic is the care and attention that our nurses give to patients to ensure that they become fully comfortable and compliant and successfully treated. Our success rate is currently 90% against an industry standard of 50%. For milder conditions, snoring and perhaps mild sleep apnea, there's a growing use of oral appliance therapy to assist patients with sleep disordered breathing conditions. Different oral appliances, you can see there are mandibular repositioning devices, splints and tongue retaining devices. All work on the basis of moving the jaw and or the soft tissue in the oral cavity forward and clear of the airway, so that the soft tissue doesn't collapse backwards into the airway and obstruct or disturb breathing while the patient is asleep. One of the key benefits of oral appliance therapy is that it normally involves a device that sits comfortably and virtually invisibly inside the mouth, fitted over the teeth. That makes it an extremely discreet, and if it's been properly constructed, an extremely comfortable form of treatment. But again, it is typically only recommended for people who have snoring or mild sleep apnea. For the more serious conditions, then CPAP is typically recommended as the most appropriate form of successful effective treatment. Once again, as you can see from the diagram, the concept of oral appliance therapy is to move the lower jaw or mandible and any connected tissue, the tongue and so forth, forward and clear of the airway to eliminate any restriction of the airway while the patient is sleeping. Now, with any form of sleep disordered breathing, whether it's simple snoring or something as nasty as severe sleep apnea, the starting point for treatment is to undergo a diagnostic sleep study, otherwise known as a polysomnogram. The diagnostic sleep study is worn overnight, and it monitors brain activity, heart activity, pulse oximetry, blood oxygen levels in the bloodstream. It looks at body positions, sleeping positions, movement through the night, limb movement, etc., etc. A vast range of different factors that help sleep physicians to determine exactly what the nature and severity of the condition is. At the sleep therapy clinics, we have the capacity to provide the diagnostic sleep study with a portable diagnostic recorder, which means that instead of having to spend a night in a hospital-based sleep clinic or sleep laboratory environment, We can bring the sleep recorder to you, and you can wear it overnight in the comfort and privacy of your own home, which is obviously a lot less expensive, usually much faster, and certainly a lot more comfortable and less intrusive. So the good news is that there are a range of very effective treatment options available for sleep disordered breathing conditions, whether it be as simple as snoring or as nasty and severe as obstructive sleep apnea. In either case, what we would encourage you to do is give us a call. You can see the number on the screen there. It's Brisbane number 0732182171, or pay a visit to our website at sleeptherapyclinic.com. And you'll find a huge amount of information on the causes, effects and treatments of sleep disordered breathing conditions, including a self-assessment questionnaire that you can download and complete for yourself to determine whether or not you have a condition that warrants going to a doctor to request a referral for a sleep study. In any case, if you have any questions, please give us a call. We'd be more than happy to help. There's no cost or obligation in doing so, and much of the cost of the sleep study in the first instance is covered by Medicare in any case, so very little investment involved in finding out just what it is that needs to be done to improve your health, well-being and relationships. We look forward to seeing you in our clinic soon, and best of health to you in the meantime. Bye now.